Does breast cancer affect men? Here's the truth. According to the National Breast Cancer Organization, it's been estimated that 2,190 men are affected by breast cancer every year, and out of that number, 410 of them die. This number might sound very low, might not sound so much, but then it's advisable that men also should undergo breast self-examination and follow the tips I'm going to be highlighting out in this video. My name is Dr. Kelly and you're welcome to Prime Health 360. What is breast cancer? Breast cancer is when the gene responsible for the growth and replication of the breast cells is being altered, which leads to abnormal growth of breast cells, even affecting healthy breast tissues, spreading through our lymph nodes and affecting the body in general. This then gives rise to occurrence of different symptoms we see in our breast shape, size, and texture. These symptoms are mostly seen on the breast, and number one on that list is breast lump. Breast lump is any solid lump or mass found in the breast area. It can be found out by breast self-examination. That means using your palm while standing up and running through your breast tissue in a clockwise or anti-clockwise manner, and extending also into your axilla. So you get your hands running through in a clockwise manner or in an anti-clockwise manner till you get to your axilla, that is your armpit. That's how we check for breast lump. If any lump is found, the lump can be cancerous or non-cancerous. That's what we call benign or malignant. That being said, if we find any lump in our breast, let's endeavor to see our doctor so they can run a biopsy and find out if it's cancerous or not cancerous. But generally, a lump found on the breast is a sign of cancer until proven otherwise. So let's endeavor to see our doctors for further investigations to be carried out. The second symptom will be change in breast shape, size, and appearance. Now, in this situation, we find our breast looking like the back of an orange. Do we know what the back of an orange looks like? Like swollen-ish, inflamed? Yes, that's how the breast will look like if it has cancer cells. So let's just observe for that sign on our breast. The third point we'll be going over to is inverted nipple. Newly inverted nipple. There are some people who have an inverted nipple naturally, but if you find out that you have a newly inverted nipple, that is a red flag. Please go see a doctor for further investigations to be carried out on you. The fourth symptom will be discharge from our nipple. When you notice any bloody discharge from your nipple, please endeavor to see your doctor for further investigations to be carried out on you. Another symptom we talk about is breast dimpling. That means if you carry a finger and put it on the breast, it will form a depression. So that's it. That's another way to check for it. Take your finger, press on the breast. If it goes in, that is what we call breast dimpling, and that is a sign of cancer. Please go see your doctor for further investigations to be carried out. The next symptom we're talking about is scarring or peeling of the breast. That means you notice that the skin on the breast is peeling off, or it's becoming scarred, it's becoming hard, it just looks very weird there. Please, when you notice that, endeavor to go see your doctor for further examination. Now let's talk about risk factors. Nobody has been able to find the cause of breast cancer, but we have been able to relate it to some risk factors. Number one is age. The older you get, the more you are at risk of having breast cancer. So when we get to a particular age like 35, let's us endeavor to go for our routine checks. Let's see a doctor and let's get some laboratory investigations carried out on us when we get to a particular age, so that we can be able to rule out any cancerous cells in our body or discover if we have any cancerous cells in our body. The second risk factor we have is hereditary. If we have an uncle, an auntie, mother, brother, or sister who has suffered breast cancer or any form of cancer at all, we are at risk of having that cancer. So let's endeavor to go do our routine checkups and see the doctor so you can recommend tests for us that can be able to detect cancer cells in our blood. The third risk factor we have is early menstruation. Girls who see their period before the age of 12 are at risk of having breast cancer. So if you're in that situation, please go see a doctor when you get to a particular age, like 35, so they can be able to carry out some lab investigations for you and rule out any cancer cells in your blood. The next risk factor we're talking about is late menopause. Women who tend to have their menopause by the age of 55 are at risk of having breast cancer. So please go see your doctor and get your routine checks so as to be able to pick up these cancerous cells in good time. The next on our list will be obesity. Research has shown that obese people are at risk of having breast cancer. So let's endeavor to please get our routine checks and do our breast self-examination in order to pick up any of these signs in good time. Next on my list will be hormonal replacement therapy. Women who are undergoing menopause are placed on hormonal replacement therapy. That means they'll be taking some hormonal drugs which will see them through their menopausal phase. And these drugs puts them at risk of having breast cancer. Next on my list will be birth control pills. A woman of reproductive age is required to take birth control pills twice in a year. Anything higher than that predisposes you to having breast cancer. So ladies in reproductive age, let us try and take our birth control pills reasonably, and that is taking it twice in a year to avoid us having breast cancer. The next to be excessive alcohol intake. Research has shown that women who excessively take alcohol are predisposed to having breast cancer. The next one is to be women who have their first pregnancy at the age of 35. Having a pregnancy at the age of 35 means you're having your pregnancy at advanced maternal age, and that predisposes you to having breast cancer. And also, not getting pregnant before the age of 35 predisposes you to having breast cancer. Another risk factor to talk about would be dense breasts. That means ladies with very full breasts are at risk of having breast cancer. So if you have a big breast, please do your breast self-examination and see your doctor for other routine checkups. How do we check for breast cancer? As I said before, we can do the breast self-examination, which is taking our hand while standing up and running it through our breast tissue in a clockwise manner or anti-clockwise manner. And let us not forget to also check our armpit too for breast lump. Another way we can check for breast cancer is by doing a mammogram. A mammogram can be done for only ladies above the age of 45. Ladies below that age are not advised to do a mammogram. Mammogram is a laboratory investigation carried out to detect for breast cancer cells in the breast tissue. Another way to check for breast cancer is by doing a biopsy. This is when a special needle is taken and used to extract part of the breast tissue. This part of the breast tissue that has been extracted is then viewed under a microscope for cancer cells. Doing all these procedures will make us detect breast cancer cells in time while it's still treatable with the following treatment options like chemotherapy. Chemotherapy is when we're giving some particular type of drugs which targets those cancer cells and destroys them. And we also have radiation. Radiation is when heavy rays are being targeted on these cancer cells to stop their growth and kill them in the long run. We can also have hormonal therapy. Hormonal therapy is when we use hormonal blocking drugs to prevent hormones sensitive to breast cancer from returning after we have done our breast cancer treatment. To sum it all up, women between the age of 50 and 74 and women who are at risk of having breast cancer should endeavor to go for breast screening at least twice in a year. And also, we should do breast self-examination at least 3 times in a month. And if a lump is detected, please go see your doctor so further investigations can be carried out to determine if the breast lump is cancerous or not. Do subscribe to our YouTube channel and hit the notification bell so you'll be notified whenever we upload a new video. Follow us on our social media platform and do visit our website www.primebusiness.africa. I remain your host, Dr. Kelly, and until our next episode, this is Prime Health 360.